Colombia, it's a little bit complex because Colombia has universal healthcare coverage. So, and actually one of the main drivers of reduction of poverty in Colombia has been healthcare, because since the 90s we moved to this system that pays for almost everything in health. It's a public insurance, and people don't need to be impoverished to pay for their health. They don't need to sell their stuff, or they don't need to go into debt to pay for healthcare. So in Colombia, actually, these all this trade in health, and especially the monopolies that are created via intellectual property, impact public budget, right? Sometimes even because of the prices of medicines, even the healthcare system and all the insurers that we have multiple insurers, well, they start putting up barriers to access because they don't want to pay for these expensive medicines. And so, I think since I've been working on this, when I came to this world, like already like the HIV wave of it had happened. It was earlier, before my time. So, it was like the first consequence of having these strong IP rules around the world. It was the access to antiretrovirals, and that brought all these, the first wave of activism on access to medicines, which was related to HIV. I think in Colombia, one of the main similar issues around that in my time has been the access to anti-hepatitis C medicine. So these direct acting antivirals, right? So we had to prepare and do a lot of things to be able to guarantee these medicines for the people, which were so expensive. And then now, more recently, of course, all the debate around vaccines for COVID and the IP barriers that they have, and that have not allowed everyone to access those vaccines in a timely manner. There were a lot of incentives to prescribe new medicines that do not have proven added value. So they are not better than the medicines that already exist on the market, but they cost a lot, and the pharmaceutical company invest a lot in marketing, so these medicines get prescribed, and this drew pharmaceutical expenditure to the roof in Colombia. And so that was the talk at the time, and at the end of government, of Uribe's government, the talk was like, we need more money to pay for that. And the other side were, no, we don't need more money. We need to take measures to better use the resources we have. We need to stop monopolies. We need to increase market competition. We need to control prices, because it was shown also by civil society organizations that the prices Colombia was paying for medicines at the time were like the highest in the region, and sometimes even higher than countries in Europe, like Norway or Spain or Portugal. Countries that are far more developed and far more rich than Colombia were paying cheaper medicines than us. So that was like the conversation at the time. Santos government came in, and that was different. I think that changed. This relation of recognizing social movements and recognizing NGOs and trying to lower that stigma that they had here. So there was also a better relation with the press, I think. So there was more space for free press. and for, acknowledging that the press has to control the power of the government and not being suspicious about that. Um, I can, I think the minister, and when I worked at the government, we had a very particular relation with the press, which was interesting. We called it radical transparency. Actually, it was like a strategy, deliberate strategy that we used to publish like all communications that we got, all of the letters we got when we were doing all sorts of things around pharmaceutical policy. We decided we should publish that on our website because that was the only way to resist the pressure. There's a lot of pressure when you're working on pharmaceutical policy and access to medicine coming from very powerful organizations like pharmaceutical companies that have a lot of money, and also the government, so where the headquarters of those companies are placed. So we have letters, constant letters from government of the US, Switzerland, England, France, and all the guilds. And so we said, the only way to resist is that this is public and that these companies be made accountable by the public and the press. And so we use the radical transparency strategy, and the president allowed it, right? So we were going to regulate the price of Nexium. Nexium is one of the best sellers of AstraZeneca. I don't think if it was Nexium or it was an antibiotic. I don't remember the medicine properly, but it was probably Nexium. And so AstraZeneca, of course, was against it. Many of them said, that price is too low. And we were like, but that price, because we did international reference pricing. So it was not a price we made up. It's a price that exists in some other countries. We were saying, but in other countries, you're selling this medicine with that price. Why don't you sell it to us at the same price? And they were, because of the roads here, or, whatever, the roads and the infrastructure or the healthcare system or whatever excuse to say that price that's there in the country, it's particular to the characteristics of that country, and that's why I cannot replicate it to Colombia. And we were like, okay, so show us your price structure, like your cost structure. We want to see it. Oh no, that's secret, right? Anyway, so AstraZeneca came and said all those arguments, and we said no. So the technical group said, no, we are going to regulate the price. At the beginning, they weren't even saying you're making a mistake in the calculation or whatever in the methodology. They were saying do not regulate it. Just remove it from the list of medicines that are going to get their price regulated, which was also not chosen randomly, right? So that list of medicines was chosen because of their impact on healthcare expenditure. So when we said no to them directly in the technical group, they managed to get the British ambassador to write a letter to the minister, saying, minister, I have that letter somewhere. Minister, we are close friends, Britain and, England and Colombia, and, we create jobs, and AstraZeneca is one of our main companies, and, maybe you shouldn't regulate the price of these medicines. This will affect the number of jobs that AstraZeneca creates here, etc. And so we decided to publish that letter on our website as a comment to the regulation. The newspapers picked the letter up and wrote articles the headlines were this is the pressure of the a British government to the Colombian government so that prices of medicines do not get regulated. And the newspapers were like, this is our business. Why other countries are getting into our internal business? So the meeting was just between the ambassador and the minister, and I think some people of the foreign relations office of the ministry. And then when the meeting ended, he called us, like the minister called us, and we were like, so what happened? Did he complain? Did he tell you off? And he's like, no. He came to apologize. We were, what? We cannot believe this. Yes, the ambassador apologized. He said that this was really the business of the Colombian government, that that our governments, all of the governments in the world are facing the problems of high prices, and AstraZeneca did not explain to him the situation really well, and he felt a little bit used by AstraZeneca. And we were like, oh wow,